All right, so today we're going to take a deep dive into giant cell tumors of bone, or GCTs for short.
Okay.
This sounds kind of scary, right?
Yeah,
But luckily, we've got an expert here to break it all down.
absolutely.
So we really want to understand what GCTs are.
Okay.
How are they diagnosed? How are they treated? And what can people expect long term?
Sounds good.
We're mainly going to be using this article from bonecancer.inn.
Oh, that's a great resource.
It seems really informative.
Yeah, it is.
So first things first, I think it'd be helpful to kind of distinguish
Sure.
benign tumors from malignant tumors.
Absolutely.
What does benign actually mean?
So a benign tumor is one that's not going to spread to other parts of the body. It's
Right.
not going to metastasize, right?
Gotcha.
Unlike a malignant tumor, which is cancerous,
Yeah.
but it doesn't mean that it's harmless.
Right, because it could still cause problems depending on the size
Absolutely, yeah.
and the location.
If it's like near a nerve or it's weakening a bone, then it could
Yeah.
cause problems.
Okay, so that brings us to giant cell tumors,
Yes,
which are considered aggressive benign tumors.
that's right.
Now, that sounds like a contradiction, doesn't it?
It does.
Aggressive but benign.
Well, it means that they can be locally aggressive, so they can grow quite quickly and damage the surrounding bone.
Okay.
But they very rarely spread to other organs like the lungs.
So they're aggressive in the sense that
Yeah.
they're growing quickly,
Exactly.
but not
They're
necessarily.
not going to spread throughout your whole body,
Yeah.
very rarely.
And even then, I read in the article that it's usually
Yeah.
treatable.
It's treatable, that's right.
So who usually gets GCTs
Yeah.
and where do they show up?
So they're more common in women
Okay.
between the ages of 20 and 40.
Interesting.
And they typically arise in the epiphysis, which is the rounded end of a long bone.
So that's why we see it a lot around the knee, the wrist, the hip,
That's exactly, yeah.
the shoulder,
Yeah.
the pelvis.
That's right.
And we don't really know why it's more common in women
Not really sure.
between those ages.
No.
So that's another one of those medical mysteries.
Absolutely.
Right.
Yeah.
So what are the symptoms? How would someone know
Right.
that they might have a GCT?
The most common symptom is pain.
Hmm.
And it's a dull, aching pain
Okay.
that can last for several months, like 3 to 6 months.
Uh-huh.
You might also get some swelling in
Yeah.
the area.
And if it gets bad enough, you could have like a pathological fracture, right?
That's right.
Or the bone's so weak it just breaks.
Yeah.
Okay, so if you suspect you might have a GCT,
Mm.
what's the next step?
Well, you'd go see your doctor, and they'd order some imaging.
Uh-huh.
So probably start with an X-ray,
Mhm.
and then maybe an MRI,
Yeah.
get a better idea of what it looks like.
Okay.
What's going on in there?
But is that enough to diagnose it?
Not definitively.
Mhm.
You really need a biopsy to confirm.
So they'd take a little sample of the tumor,
Exactly.
and then they'd look at it under a microscope
That's right.
to see if it has these giant cells.
To look for those giant cells, yeah,
Got it.
which are the hallmark of a GCT.
Okay, and there's this classification system, right?
Yeah, that's right.
That doctors use to grade GCTs?
Yes, it's called the Campanacci classification system.
Okay, so tell us a little bit about that.
All right, so there are 3 grades.
Okay.
Grade 1,
Uh-huh.
also known as latent. It's the least aggressive,
Um,
and it's well defined and contained within the bone.
So it's kind of like a well-behaved tumor.
Yeah, you could say that.
Right.
Yeah.
Okay, what about grade 2?
Grade 2 is called active,
Hmm.
and this is when the tumor is starting to erode the surrounding bone.
Oh, so it's getting a little bit more
Yeah.
aggressive.
Yeah, it's not quite as well behaved.
Okay.
Great.
What about grade 3?
Grade 3 is aggressive,
Ah.
and that's the most worrying one.
Okay.
It's got poorly defined borders. It's causing significant bone destruction,
Okay.
and it may even involve the soft tissue.
So that's one where you really want to catch it
Exactly.
early.
Right. Absolutely.
And knowing the grade helps the doctor determine the treatment plan.
That's right.
So when it comes to treatment for GCTs, I think the first thing that comes to mind for most people is surgery.
Yeah, typically that's the first line of treatment.
Okay, so is that always the case?
Generally, yes, but there are some situations
Right.
where surgery might not be suitable.
Mm.
For example, if it's in the pelvis, the sacrum,
Mm.
the spine.
Got it.
And we'll talk about those a little bit later.
Okay, so,
Yeah.
but in most cases,
Yeah,
surgery is going to be the first step.
typically.
And the specific type of surgery is called extended curettage.
That's right.
I'm kind of curious. What does that mean? What does that involve?
So basically, the surgeon uses a high-speed burr, which is like a tiny little drill,
Okay.
and they remove the tumor and a small margin of surrounding bone. And it's quite a delicate procedure, and it needs to be done very carefully
Okay.
to get all of the tumor out, but minimize damage
Oh,
to the healthy tissue.
so they go in there and they very meticulously remove it.
Exactly.
So what happens to the bone afterward?
Well, we need to reconstruct the bone
Mm.
to provide stability
Okay.
and support.
So are there different ways to reconstruct the bone?
Yeah, there are several options, each with their own
Mm.
pros and cons.
Okay, that's interesting. Let's talk about that.
Absolutely.
Okay.
Okay, so let's talk about those options for reconstruction.
Okay.
One common method is to use bone grafts.
Bone grafts. What are those?
Well, it's basically where we use bone tissue either from the patient's own body,
Okay.
that would be an autograft, or from a donor, which is called an allograft.
Okay.
And we use that to fill the space that's left after the tumor is removed.
So you're basically patching it up with new bone material.
Exactly, yeah.
Okay. And what are the advantages of using bone grafts?
Well, it's a biological reconstruction, so
Oh.
it encourages the body to heal naturally. And the graft will actually integrate into the existing bone structure.
Oh, wow. That's amazing.
Yeah.
Are there any downsides to bone grafts?
Well, the main one is that they tend to have a longer healing time
Okay.
than some of the other methods.
So it's a bit of a trade-off then.
Yeah.
Okay, so what other options are there besides bone grafts?
Another common technique is to use cement.
Cement.
Yeah, a special type of cement called PMMA. And this acts like an internal cast.
Okay.
It provides immediate support to the bone.
Okay, so it's kind of like a
Yeah.
temporary solution until the bone can heal.
Yeah, it's not a biological solution,
Right.
but it provides stability.
And I read that it can also help to detect if the tumor comes back.
That's right, yeah.
So if the tumor starts to grow again,
Yeah,
it might actually push the cement out of place.
exactly.
So
Yeah.
that would show up on a scan.
Right.
So it's kind of like a built-in early warning system.
Yeah, you could say that.
Are there any drawbacks to using cement?
Well, as I said, it's not a biological solution, so it doesn't really encourage natural healing.
Right.
And there's also a risk of developing osteoarthritis
Okay.
if it's used near the joint cartilage.
Because it can wear down the cartilage.
That's right, yeah.
So cement's more of a short-term solution
Yeah,
with potential long-term drawbacks.
that's right.
Okay. So sometimes they'll actually combine these methods, right?
Absolutely, yeah. So they might use a bone graft for biological reconstruction,
Uh-huh.
but then reinforce it with screws, plates, or nails for added stability.
So it really depends on the individual case.
Exactly, yeah. It depends on the location, the size of the tumor,
Right.
the patient's overall health.
Okay. So what happens if the GCT is in like a really tricky spot
Right.
where it's just too dangerous to operate?
Well, in those cases, we might consider alternative treatments,
Yeah.
like medication.
Oh.
So there are some medications like zoledronic acid
Uh-huh.
and denosumab
Okay.
that can help to shrink the tumor.
Oh, so the medication can actually shrink it.
Yeah, it can.
Wow, that's amazing.
It's a type of targeted therapy
Huh.
that inhibits the activity of cells involved in bone breakdown,
Okay.
which is a key feature of GCTs.
So it's like it's putting the brakes on the tumor's growth.
Exactly.
Yeah, okay. What other non-surgical options are there?
Another technique we use is called angioembolization.
Okay, angioembolization, that sounds
It's
complicated.
basically where we block the blood vessels that
Right.
are supplying the tumor. So it cuts
yeah.
off its blood supply, essentially.
So you're starving it of oxygen and nutrients
Exactly.
so that it can't grow.
That's right.
That's really clever.
It can be quite effective.
So are these alternative treatments typically as effective as surgery?
Well, they can be effective in certain situations,
Okay.
especially for inoperable tumors. Or sometimes we use them to shrink the tumor before surgery.
So that makes the surgery less
Exactly, yeah.
invasive.
Less invasive, that's right.
Okay, so it really depends on the case.
Absolutely, yeah. Every case is different.
Okay, now I want to shift gears a little bit and talk about recurrence.
Okay.
Because I think that's one of the biggest concerns for anyone who's been diagnosed with a tumor.
Understandably, yeah.
How likely are GCTs to come back after treatment?
Well, historically, they had a fairly high recurrence rate. But with modern surgical techniques,
Okay.
especially this extended curettage with a high-speed burr, the recurrence rate has actually dropped quite significantly, down to about 4 to 8%.
So it's not a guarantee, but it's much lower than it used to be.
Exactly, yeah.
What are some of the factors that can influence whether a GCT comes back?
Well, the grade of the tumor,
Okay.
the location, the extent of bone destruction,
Okay.
and how well it was removed during the surgery.
Okay, so it's really important to have a skilled surgical team
Absolutely, yeah.
and to get regular checkups after the procedure.
Exactly.
Speaking of checkups, what does follow-up look like after GCT treatment?
So regular monitoring is essential.
Okay.
Typically, we see patients every 3 months for the first 2 years after treatment.
Okay.
And we do imaging studies like x-rays,
Hmm.
maybe CT scans.
So it's a lot of close monitoring.
It is, yeah, for the first couple years. And then after that, we usually switch to annual monitoring, unless there are any concerns.
Right, okay, so it's like a watchful eye,
Yeah,
making sure everything stays on track.
exactly.
I think this has been incredibly helpful.
I'm glad.
We've really unpacked a lot about GCTs,
Yeah.
from the diagnosis to the treatment options,
Yeah.
the different types of surgery,
Right.
the alternative treatments, and the importance of monitoring for recurrence.
Yeah.
But I want to touch on something we talked about earlier, which is the emotional impact
Right.
of a GCT diagnosis.
Yeah,
Because it's one thing to understand the science,
absolutely.
but it's another thing to deal with the emotional roller coaster,
Yeah, definitely.
of actually having this diagnosis.
It can be very overwhelming
It can, yeah.
for patients.
So what advice would you give to someone
Right.
who's just been diagnosed with a GCT and they're feeling overwhelmed?
I think the most important thing is to reach out for support,
Okay.
whether that's from loved ones, friends, support groups,
Okay.
or even mental health professionals.
So it's really important to not try to go through this alone,
Exactly, yeah.
to have people to talk to,
Yeah, absolutely.
to lean on,
It can make a huge difference.
and to remember that this isn't a death sentence.
That's right, yeah.
GCTs are treatable,
They are, yeah.
and there's a good chance of a full recovery.
Absolutely.
Okay, so we talked a lot about surgery being the primary treatment,
Yeah.
but are there any situations where surgery might not be the best option?
Yeah, there are some cases where it might not be feasible or advisable, like if the tumor is in a difficult-to-reach area,
Okay.
like the spine.
Yeah, because it's a very delicate area
It is, yeah.
to operate on.
So in those cases, we'd consider alternative treatments like medication or radiation therapy
Okay.
to control the tumor's growth.
So it's really about weighing the benefits and risks
Absolutely.
of each approach.
Yeah.
And choosing the path that's right for the individual.
That's right.
Okay. And what role does the patient play in this process?
Oh, the patient plays a huge role. It's really important for patients to be empowered to ask questions,
Yeah.
seek second opinions if they need to, and voice any concerns or preferences they have.
So it's not just about blindly following the doctor's orders.
No, not at all. It's a partnership.
It's a collaboration.
Exactly.
Okay, what are some of the key questions that patients should consider asking?
Okay, some good questions to ask are, what are the different treatment options available?
Okay.
What are the potential benefits and risks of each option? What's the likelihood of success with each treatment?
Oh.
What's the expected recovery time? What are the potential long-term side effects?
Okay.
And what kind of support and resources are available?
So it's really about being informed
Absolutely. Yeah.
and making sure that you understand all of your options.
Yeah, and that you're comfortable with the treatment plan.
And our listeners, those are just starting points.
Right.
Don't hesitate to ask any other questions
Yeah, any questions that come to mind?
that you might have.
Yeah,
Your healthcare team is there to support you.
they are.
Okay, so we've covered a lot of ground today.
We have.
From the science of GCTs
Yeah.
to the diagnosis, the treatment options, the emotional aspects, and even the importance of patient empowerment.
Right.
I want to circle back to recurrence one last time because I know that can be a big source of anxiety.
We can, yeah.
Even though the rate has gone down, it's still a possibility.
That's right.
So what are some of the red flags that people should watch out for?
Well, the most common one is the return of pain in the area where the tumor was originally located.
Okay.
So if you start to experience pain again, that's definitely a sign to get checked out.
Okay, what else?
Other warning signs include swelling,
Okay.
limited range of motion, and any noticeable weakness.
So if you notice any of these things,
Yeah,
it's best to contact your doctor right away
absolutely.
because early detection is key,
Yeah, the sooner we catch it, the sooner we can start treatment.
and the better the chances of a successful outcome.
That's right.
So it's like putting out a small fire before it turns into a big one.
Exactly.
Okay.
Yeah.
And even if a recurrence does happen,
Right.
it's not a sign of failure.
No, not at all.
It just means we need to adjust the treatment plan.
Exactly.
Yeah. Okay, so it's a bump in the road, not the end of the journey.
That's right.
Okay, before we move on to our final thoughts,
Sure.
I want to acknowledge that every journey with a GCT
Right.
is a personal one.
Yeah, absolutely.
And there's no one-size-fits-all approach
That's right.
to coping with the diagnosis.
Every patient is different.
So what are some of the resources that people can turn to for support?
Well, support groups can be incredibly helpful,
Okay.
both online and in person.
Hmm.
They provide a space for people to connect with others
Okay.
who understand what they're going through.
That sense of community can be really powerful.
They can, yeah.
Right.
Yeah.
What about organizations?
Yeah. There are some great organizations out there dedicated to bone cancer research
Okay.
and patient advocacy,
Okay.
like the Bone Cancer Research Trust
Mm-hmm.
and the Liddy Shriver Sarcoma Initiative.
Okay. And they offer a wealth of information and support.
They do. Yep.
So there's a lot of help out there
There is.
for people who need it.
Yeah.
I think it's amazing to see so many people
Yeah.
and organizations working so hard to improve the lives
It is. Yeah.
of those affected by GCTs.
It's inspiring
Yeah.
to see that.
Okay, so we're nearing the end of our deep dive.
Okay.
But before we wrap up, I have one final thought-provoking question.
Okay.
We've talked about the medical aspects,
Yeah.
the emotional aspects,
Yeah.
but what about the social impact?
Right.
How do these tumors affect people's relationships, their work lives, their sense of self?
Yeah, that's a great question. And it's important to address the whole person, not just the physical symptoms.
Right, because a GCT diagnosis can have ripple effects
Absolutely.
that extend far beyond the physical.
It can affect relationships, work, self-esteem,
Exactly.
quality of life.
So what can be done to support people in those areas?
Well, things like support groups,
Okay.
counseling, occupational therapy can all be really helpful.
Okay, so it's about recognizing that a GCT diagnosis isn't just a medical event.
Right.
It's a life event
It is. Yeah.
with a lot of different implications.
Yeah, absolutely.
All right, well, before we sign off,
Okay.
do you have any final words of wisdom
Hmm.
for our listeners?
I would say to anyone out there who's been diagnosed with a GCT or who knows someone who has, remember that you're not alone.
Yeah.
There are resources available,
Yeah.
support systems in place,
Yeah.
and a community of people who understand what you're going through.
So reach out, connect with others,
Exactly.
and remember that knowledge is power.
It is.
Stay curious, stay informed, and stay healthy.
Absolutely.
Okay, on that note of empowerment and hope,
All right.
let's move on to our final thoughts.
Okay.
Okay, so we talked about, the social impact and all that, but what about physical recovery, especially after surgery?
Yeah.
What can people expect and how can they get back, their strength and their mobility back?
So that's where physical therapy comes in. It's really important.
So it's not just about resting
No.
and letting the bone
Well,
heal.
it's an active process.
Okay, so what does physical therapy typically involve for GCT recovery?
So it usually involves a combination of exercises,
Okay.
stretches, manual therapy techniques, and sometimes even assistive devices.
Okay, so can you give us some examples?
Yeah, so we might use range of motion exercises to improve joint flexibility and prevent stiffness.
Okay.
Strengthening exercises are important to help build up those muscles around the affected area. And balance exercises can help improve coordination
Okay.
and reduce the risk of falls.
So it's really comprehensive.
It is, yeah.
It's not just about, one specific area.
No, it's about getting the whole body working properly again.
Is the intensity of the therapy the same for everyone?
No, not at all. It really varies depending on the type of surgery, the individual's overall health, and how they're progressing.
So it's really tailored to the individual.
It is, yeah.
Okay, you mentioned earlier that there might be a genetic component to GCTs.
Yes.
Can you elaborate on that a little bit?
Sure. Research has shown that there are certain gene mutations that can increase the risk of developing GCTs. One example is a mutation in the H3F3A gene,
Okay.
which plays a role in regulating cell growth and development.
So if that gene's not working properly,
Yeah,
it could lead to uncontrolled cell growth
exactly.
and potentially a tumor.
That's right.
Are there other genes that are being studied?
Yeah, there are a few others that are under investigation.
And as we learn more about these genetic links,
Hmm.
it could potentially lead to better treatments.
Absolutely.
Maybe even ways to identify people who are at higher risk
That's right.
before the tumor even develops.
That's the hope.
Wow, that's really exciting.
Yeah. It's a promising area of research.
This has been a truly fascinating deep dive.
It has.
We've learned so much about GCTs,
Yeah.
from the diagnosis to the treatment to the recovery and even the potential genetic factors.
It's been a pleasure talking about it with you.
And thank you to our listeners for joining us on this journey of discovery.
Yes, thank you.
I think it's amazing how much progress has been made
It is, yeah.
in the treatment of GCTs
Absolutely.
and the resilience of the human spirit.
Yeah, it's truly inspiring.
So until next time, remember, knowledge is power.
It is.